Male pelvis. The pelvis is the most inferior region of the trunk. It contains the reproductive organs, as well as the rectum and bladder. The urinary bladder is a muscular, pouch-like organ of the urinary system. It is shaped like a triangle or a pear. Located in the pelvis, it lies behind the pubic bone, above the prostate, and in front of the rectum. The main function of the bladder is to receive and store urine that is produced in the kidneys and transported to the bladder through the ureters. The average adult can hold 400 to 600 milliliters of urine in the bladder. Urinary system. Aside from the bladder, the urinary system consists of the kidneys, ureters, and urethra. The kidneys are bean-shaped organs found in the most posterior part of the abdomen. They filter the blood, extracting fluid and waste and producing urine. This urine is transported through the ureters, muscular tubes of 25 to 30 centimeters in length, from the kidneys to the urinary bladder. The external urethral sphincter is a muscle that keeps the urine from leaking out of the bladder and allows for voluntary urination. Finally, the urethra is a tube that carries urine from the bladder and semen from the male reproductive system through the prostate and out of the penis. Several parts of the male reproductive system are located near the bladder and have a direct relation with the urinary system. The prostate gland is an accessory reproductive organ found directly under the urinary bladder. It is a small, firm gland about the size of a walnut that surrounds the second section of the male urethra. The testicles, are paired, ovoid glands about the size of small plums that sit within the scrotum. Also within the scrotum are the epididymis, paired, comma-shaped structures made up of a long tube that is very tightly coiled and continues as the vas deferens. The seminal vesicles are small, paired, pouch-like glands located behind the bladder and in front of the rectum. They narrow into ducts that fuse with the vas deferens to form the ejaculatory duct. This duct travels within the prostate to transfer semen into the urethra for its expulsion. The penis is a tubular-shaped organ, responsible for erection, also houses the urethra. Rectum. The last two sections of the large intestine, or colon, are the sigmoid colon and rectum. The sigmoid colon is a continuation of the descending colon. It is S-shaped and located in the pelvis, directly in front of the sacrum, lowest section of the spine. The rectum is the last portion of the large intestine. It is straight and travels through the pelvis until it reaches the muscles of the perineum, area between the anus and the pubic bone, where it continues as the anal canal. In men, the rectum is located behind the bladder, prostate, seminal vesicles, and urethra. The urinary bladder is surrounded by the muscles that make up the abdominal wall and pelvic floor. The anterior and lateral walls of the abdomen consist of 4 large muscles: the rectus abdominis muscle, external oblique muscle, internal oblique muscle, and transversus abdominis muscle. These muscles are responsible for stabilizing the vertebral column, moving the trunk, and keeping all of our abdominal organs within the body. The pelvic floor is made up of the coccygeus and levator ani muscles. These muscles stretch from the pubic bone to the coccyx, providing holes for the rectum and urethra to pass through. They are responsible for holding up the pelvic organs and aid in urination and defecation. The bladder is supplied with oxygenated blood mainly by the superior and inferior vesical arteries, branches of the internal iliac artery. It also receives small branches from the obturator artery. The deoxygenated blood is drained by veins of the same name and trajectory as the arteries. These form the vesical venous plexus that drains into the internal iliac vein. The bladder is innervated by the inferior hypogastric plexus, which receives both parasympathetic and sympathetic input. Parasympathetic impulses aid in urination, and sympathetic impulses keep the urine from leaking from the bladder.